In this video, we discuss the use of itraconazole during cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Itraconazole was discovered in the late 1970s and has been approved for human use since 1992. It has been used in hundreds of millions of patients and has a very good safety profile. In one study, it caused liver enzyme elevations in 1.5% of patients, while the placebo group had a rise in 0.7% of patients. Originally approved for human use as an anti-fungal agent, it has shown efficacy against cancer via a variety of pathways. Importantly, it inhibits the hedgehog pathway, meaning it inhibits communication from the cancer cell membrane, where the cancer receives all information about its surrounding environment, and the nucleus, where orders involving replication, etc., are executed. The cancer cells are prevented from dividing and commit suicide via apoptosis. There are only 3 FDA-approved cancer drugs listed in the drugs.com database that inhibit the hedgehog pathway, and itraconazole is far less toxic than all of them. These 3 hedgehog inhibitors are typically used in basal cell carcinoma. The most commonly used is probably vismodegib, yet itraconazole is more effective at inhibiting the hedgehog pathway than vismodegib. Other members of the same family of antifungals, the azoles, are nowhere near as effective at inhibiting the hedgehog pathway as itraconazole, with ketoconazole, its closest rival, being only 1/10 as effective. Itraconazole inhibits angiogenesis and microtubule formation via inhibition of VEGF and basic fibroblast growth factor. It inhibits hypoxia-inducible factor 1-alpha, which is normally produced when the body is in a low state of oxygen, hypoxia. It is overexpressed in many cancers. It inhibits cancer cell migration. It inhibits mTOR, another key pathway that is frequently overexpressed in cancer. The list actually could go on and on. Itraconazole is probably in competition with metformin and curcumin for fighting cancer via the most number of pathways. In cell line and animal experiments, itraconazole has been found effective against brain, breast, basal, cervical, endometrial, ovarian, oral, esophageal, pancreatic, leukemia, lung, gastric, colorectal, melanoma, and more. In an animal model, it lowered the occurrence of esophageal cancer from 32% to 8%. It has also synergized with other cancer medications in gastric cancer, leukemia, and more. There is also ample human evidence of the efficacy of itraconazole against cancer, probably as much as any other off-label medication. In gastric cancer patients who received daily intravenous of 200 to 400 milligrams itraconazole over the period of 4 or 5 days, response rates to 5-FU, the common gastric cancer drug, increased from 45% to 59%. The patients also had longer progression-free and overall survival. Itraconazole is normally taken orally and has a respectable maximal oral bioavailability of 55% when taken with a meal. It can also be taken indefinitely rather than just a few days. In a double-blind, placebo-controlled trial used concurrently with the chemotherapy drug daunorubicin, it increased progression-free and overall survival in patients with refractory acute lymphoblastic leukemia and acute myeloid leukemia. Because itraconazole has common use as an anti-fungal, it allows retrospective studies to be performed on cancer patients who had received it for its intended use. A retrospective study revealed among refractory cancer patients, again these are cancer patients who have failed their main line of therapy and whom traditional oncology largely gives up on, that Itraconazole produced a response rate of 37% in pancreatic cancer patients, a 57% response rate in biliary tract cancer, 62% response rate in breast cancer, and 44% in ovarian cancer. A case report described an 87-year-old man with recurrent basal cell carcinoma that had metastasized to multiple locations, including a tumor in his brain. After exhausting other treatment options, he was given Itraconazole plus sonidegib, an FDA-approved hedgehog inhibitor cancer medicine. After 8 months, his brain tumor resolved and his other tumors stabilized. 46 men with progressing metastatic prostate cancer were treated with either low-dose, 200 milligrams per day, or high-dose, 600 milligrams per day, Itraconazole. 48% of the high-dose and 11.8% of the low-dose patients achieved stable prostate-specific antigen, PSA levels. The high-dose treatment group also had a longer progression-free survival. 19 men with progressive prostate cancer received 300 milligrams of Itraconazole daily for 12 weeks. PSA doubling time decreased by 25% or more in 10 of the men, while staying stable in 9 of the other men. In 23 patients with unresectable metastatic recurrent gastric cancer, the addition of 400 milligrams oral Itraconazole every first and third day of the week into a standard of care regimen led to a response rate of 78%, including a 9% complete response rate with minimal toxicities. 23 people with refractory non-small cell lung cancer, NSCLC, received either 200 milligrams of Itraconazole daily or placebo. The Itraconazole group had twice as high a rate of no disease progression at 3 months than the placebo group. The Itraconazole group had an overall survival time of 32 months versus 8 in the placebo group. There were no significant differences in toxicities between the groups. Itraconazole increased the bioavailability of leukemia drug ibrutinib tenfold in humans. This list could actually even go on for longer. Human studies showing the efficacy of Itraconazole against cancer have been occurring since at least 1993, the very year after it was approved for human use by the FDA. Itraconazole is probably the single most underused off-label medication against cancer. Metformin is well known amongst many people who are familiar with the off-label drug philosophy to fight cancer, but Itraconazole is probably just as effective and used a fraction as much. For more information, please see the book Cancer Self-Defense 101 Quick Tips to Help You Survive.